We saw a dramatic increase in our surgical site infections, specifically from our C-section patients. Well, our team, the OR crew, Dr. Gustafson, Tammy Hill, our infection preventionist, we all met and broke down all of the cases to see what do they have in common, where can we change our process, what can we do, and our aim was to decrease that number of infections because we went from 2 in 2016 to 6 in 2017. Well, since we noticed that the moms that labored prior to their cesarean section, we wanted to find out what can we do different to help, what's different in that process versus a planned C-section or a labor that goes to an unplanned C-section. So before, we used to do a HIBA-Cleanse wash on the mom's abdomen prior to surgery. That was one of our nursing tasks to do before the surgery. And we decided to streamline that process. We now use chlorhexidine impregnated cloths and a black and white process, wiping them down from chin to toes, minus a few areas, before their C-section. And we all do it the same way with the same number of cloths, so they all get the same dose of that soap and cleaned the same way. So they match up more to a mom that had a planned C-section who would take a shower the night before and a shower the morning of with HIBA-Cleanse soap at home. So with that, we also noticed after we did that HIBA-Cleanse wash, we would just put that gown back down and they would go off to surgery. Well, that gown could potentially be full of a lot of yucky stuff. It could have amniotic fluid on it, sweat, blood, vomit. So now we all do that, the standardized clean down, and then we put a clean gown on the patient before they go to surgery to maintain that clean space. Something else that we noticed could be cleaned up or streamlined a little bit better was the process of how we gave the pre-op antibiotic. Everybody always got a pre-op antibiotic. It was always ordered, it was part of our process, but who gave it, who documented it, we found was not always very clear, especially when we looked back at the cases of infection. Before, the labor nurse would always pull the med, and sometimes the labor nurse would give it and document it, and sometimes the OR nurse would give it and document it, but it was never decided for sure who would do it. So we decided to designate some clear responsibilities on who's giving it and documenting it. So the labor nurse still pulls the medicine, but the OR nurse is responsible for administering and documenting the antibiotics, so it's very clear and it doesn't get missed. Well, it was really fun to see that we had a great success with implementing these steps. We had a 67% decrease in our surgical site infections related to cesarean section deliveries. We went from 6 back down to 2. It'd be nice if we could drop it back down to 0 because we've been there in 2015. Our next steps are going to be continuing to monitor and spot checking that this process is hardwired and that we continue to follow through with that. We also will meet annually as a team, myself, OR crew, Dr. Gustafson, Tammy Hill, to see if there's any other potential areas of improvement that we can make this better for the moms and strive for that 0.